As the coronavirus continues to spread in China, neighboring Japan is suddenly a cause for international concern. And not just because a cruise ship quarantined there reported hundreds of infections. What explains Japan's leap in coronavirus cases? What challenges does the Japanese government face to curb the epidemic? And what measures should it take? To talk about these and more, in the first half of the program, I'll be pleased to be joined by Yoichi Masuzoe, Japan's former Minister of Health, Labor and Welfare. That is our topic. This is Dialogue. I'm Zhou Yue. Let me start with you, Mr. Matsuzoe. A lot of people are talking about the quarantine on the Diamond Princess ship, although after 2 weeks quarantine, still 1/5 of the passengers on board were tested positive of the coronavirus. So what do you say to the effect of the quarantine?
Well, you know, it is really very, very difficult to handle infection prevention in the big cruise ship. So I guess the Japanese government did its efforts really, but unfortunately enough, more than 600 passengers and the crews were infected.
According to a reporter and a specialist of Japanese infectious disease at Kobe University, he said the situation on board the ship was chaotic and scary because there were mingling of crews and passengers and Japanese healthcare officials, and some of them wear protective suits, some others didn't. So is it that the Japanese were not prepared for what is going on the cruise ship? They didn't take enough preventive measures?
You know, the Professor Iwata, who is a very close friend of mine, and he helped me much when I was a Minister of Health and when I was, you know, fighting against the H1N1 viruses 11 years ago. So he went into the cruise ship and he discovered, well, there are some kind of mess, confusion. You know, there was not good separation between red zone and green zones. So the problem is, you know, in such a big ship, it's almost impossible to clearly define the zone. And the problem is, you know, out of 3,700 crews, 3,700 passengers at the cruise, you know, for crews, there are almost 1,000 crews who has no knowledge, who have no protection measures. So they have to serve the meals, they have to clean. So maybe crews have some problems. So of course there are many, many problems that Japanese government should have improved. But unfortunately it's too late.
And that comes back to the question, why didn't they choose another place to quarantine all those passengers and crews and allow them to stay in an enclosed space like the passenger ship?
Yeah, it's a very good point. You know, the problem is, according to Japanese government, where to find big places to receive more than 3,000 people. But my point is, if I were the Minister of Health, what I would do is, you know, separate Japanese nationals and foreign nationals. Just take passengers. You know, we have around 2,500 passengers, but Japanese are only 1,200. So 1,300 are the foreign nationals. So what Japanese government should have done is ask each country, to the United States of America, to Britain, to Hong Kong, to come to, with charter flight, to come to pick their nationals back to their own country. Now, Canada, South Korea, America did this kind of measures. But
So you said they should have done it earlier than what they've been doing.
Earlier. So we cannot find that a place which contains more than 3,000 people. But if it is 1,200 people, we cannot find out a place.
Another
so this is
more
please.
urgent concern is probably when those people, more than 400 of them, walk free from the ship after the quarantine. Still, people all over the world wonder whether it is good enough for them to just walk free from the ship, although almost every of them have tested positive. But people are saying when they get the tested, whether the test is good enough for them to walk free is a big concern. Are you worried?
Yes. You know, I'd like to explain more. You know, of course, I'm rather concerned if these people getting down, you know, from the cruise ship to the streets, and they are free to go anywhere, to, you know, eat any restaurant. If, you know, they spread all the viruses, that's a problem. But the problem now is not only these passengers, but I'm now in Tokyo. I'm going along the street, but everywhere, no one knows Mr. A or Mr. B or Mr. C. They have the viruses. So to contain only the passengers does not mean anything. So you can be infected everywhere in Tokyo, in Kyoto, or in Sapporo. So my point is to contain the people all around the world. It's almost useless because danger is everywhere. So the phase is completely changed. Of course, like the United States of America or Australia, Canada, those passengers who left, for example, today, the ship, should be confined more than 2 weeks. This is one measure. But now, Japan's situation is, you know, the more and more difficult and more serious. So that even if we can contain, no needs, almost no needs.
Well, a lot of parts of Hubei is that the government is not only encouraging, but is strongly enforcing the self-quarantine of the local population to reduce travel to the minimums. And that means people can self-isolate at home and wait out the incubation period and report their cases to the authority. You don't think that system works?
Yeah, this measure taken by the Chinese government, very good measures. If not, even if you build a new building, another new building, you know, these hospitals will be filled with the patient. So that most important thing now, in this situation, is to separate two groups, because now in Japan, for example, in hospitals in Tokyo, many people are coming to the hospital, so they can't accept. So it's not so good. So if you go to the hospital, you can be, even if you are healthy, you can be infected by the viruses in the hospital. So the now situation is slightly different. Before we can detect this Chinese tourist coming from Wuhan.
This is what exactly happened in Wuhan a month ago when patients with mild symptoms overwhelmed the local hospitals. They didn't have a triage system to sort out which patients are going where. Do you think the Japanese healthcare system is prepared for, you have known what happened in Wuhan?
Unfortunately enough, we are a little bit behind. So we have to learn the lessons what you made in Wuhan. But you know, as you mentioned, 1 month ago Wuhan was like that. But in Japan, in such a short period, everything happened, so that government cannot catch up with the situation. This is really the problem. So I am proposing to the Japanese government, to the public, now change the measures like China has changed.
But you were in charge of Japanese health policies back 2003 and 2009 when SARS and avian flu broke out. What was it like back then, and what kind of a difference is it now?
Well, change of the situation is, if I prepare both cases, almost the same. But, the 11 years ago, what I did is I started triage at the very earlier stages, so that at the beginning, everybody was feared and scared of what happened, which is the new viruses. But, shortly, I gathered all the data and analysis. Well, it's not so serious. Oh, okay, if children were affected, they are very serious. All these cases, I just list up all the symptoms, all the characters of the diseases, and I made it public. Then people understand. Well, it's not so severe. Well, I cough or I have a fever, but maybe in 2 days I can be recovered. But the problem, most difficult thing about this new coronavirus is, someone who have nothing, no, the cough or no fever, can affect other persons. 11 years ago, swine flu had not this kind of characteristics. This is one thing. The second characteristics of this new coronavirus is, like the case of cruise ships. For example, today I'm infected, but 20 days ago or 2 weeks ago, I have to wait 2 weeks to know if I'm, I have the problem or not. So during 2 weeks, I go around, I go shopping, and during this time, I affect. So this is the most important difference and most difficult thing.
I want to talk a little bit about the international cooperation. Earlier, the Chinese have received donations from Japanese of facial masks and protective gears. And today, the Chinese government announced that they will donate nucleic acid test kits to Japan. So how important is international cooperation of this sort help to contain the epidemic?
Yes, it is very important, and current close cooperation between China and Japan are very, very good things, and we appreciate that you can give us the test kits, and the Chinese people appreciate much of our assistance, for example, bringing the masks, so that we are neighbors. This is a fight against the virus. So both countries and the other, countries internationally should cooperate to win this war. So I appreciate today's cooperation between two people.
And we're not only neighbors, we are closely economically linked. The global value chain has already suffered some impact from this. Are you worried about the economic impact of this coronavirus outbreak?
Yes, I'm really concerned. In Japan, the last 3 months, the GDP increase has dropped by more than 6%. And not only Japan, of course China, but all over the world really is affected by this coronavirus. So economically speaking, this is really, really damaging factors. So that we have to, as soon as possible, win the war against the virus.
And there is another big question hanging overhead. That is
Yes.
the Tokyo Olympics. A lot of people worried about whether this will pose a big challenge to the organization of the Tokyo Olympics. Already there are some countries and even London raised the possibility that they will take over if Japan is not well prepared for what is going ahead. What do you think?
Yes. As former governor of Tokyo, I prepared the Olympic Games of this year. So we really would like to make this game successful. But as you mentioned, the situation is very, very critical because, you know, if you remember the case of SARS, SARS started in November, but ended in July. This time, new coronavirus started in Wuhan in December. So if it's new coronavirus the same as the SARS, it will end in August. So if that continues in July and in August, it's impossible to hold the Olympic Games. So we have to cooperate together to end as soon as possible this coronavirus.
Okay, let's hope.
But I'm really, really concerned about the Olympic Games.
Okay, let's hope our efforts will pay off and wish you and the Japanese people the best of luck. Thank you very much, Mr. Masanzora.
Thank you very much indeed.
Thank you.
Thank you.
And we'll take a short break and dialogue will continue after this. In the second half of this program, the Asian Development Bank has approved $2 million to strengthen the epidemic response capacity in China, as well as in Cambodia, Laos, Myanmar, Thailand, and Vietnam. Why provide such support now? How it would help each of the 6 countries? And why is Southeast Asia so vulnerable to the virus? To talk about these and more, I'm joined by Dr. Yongping Zhai, Chief of the Energy Sector Group of the Asian Development Bank. Mr. Zhai, thanks for joining us. First of all, why the Asian Development Bank put up such an initiative at this time to provide funding for those 6 Southeast Asian countries?
Thank you very much for the question. First of all, let me say first that how much we are touched by the sacrifice and the effort we have seen happening in China, the tremendous effort in combat against this virus. We are all very touched by the images we have seen. Particularly for myself, I was born in Wuhan, so for me it's emotionally very touched. I'm following this every day and seeing improvement and feeling encouraged. Now
yes,
back
indeed.
to your question, the ADB has provided $2 million to China, but also a number of neighboring countries you just mentioned, because we have considered that these countries are immediate neighbors of China, and some countries already have the infected cases. So it's our duty to provide a quick response to the country and to these countries so that we can cover the immediate needs. And it is our duty as development bank. We do this all the time. Whenever there is a typhoon in the Philippines or the earthquake in Indonesia, we are providing emergency assistance. We are rebuilding roads, power lines, houses. But in this case, we're providing medical supplies, surveillance equipment. But most importantly, we are, together with China, we are rebuilding confidence.
In the ADB statement, that these funds will supplement technical assistance in the regional areas that are affected. What kind of a technological support you're referring to?
We actually have ongoing technical assistance in many areas, including health, education, social, energy, and many areas. We are thinking that this specific money, $2 million, should supplement our larger effort. For example, that we are providing support, medical supplies and equipment for rural areas to cope with the virus. But at the same time, I think that more support is also needed to support a longer-term preparedness, like the household in rural areas should have a clean cooking, clean heating, and waste treatment. And all this would help to contain a healthy lifestyle and useful not only just to cope with this emergency situation, but also for a longer-term sustainable lifestyle. And that's our approach.
And China has been saying this country has been using artificial intelligence and big data to track the spread of the virus and also our response. And China has a good record of using those technologies to track public health trends. What do you say to Chinese efforts?
It's a great question, actually. Compared to 17 years ago, when there was a SARS outbreak, we all remember, at that time we didn't have all these technologies, digital technologies, artificial intelligence, all these online systems. And this time we have all these systems, and we are in a much better position to cope with the spread of outbreak of this virus. And last week, actually, I attended one solar energy conference. You know how many people attended online? 1.4 million people attended this conference. We all shared our opinion, you know, through the lead speakers. We have learned a lot. And I realized, actually, through the technology progresses, we have more means to protect ourselves, but also we have more means to prevent such spread of the virus, because we now have a lot of online systems. I think China in this area has a lot of experience, and ADB can be in a good position to help and to facilitate the sharing of knowledge and technologies and Chinese experience in combating the virus with other developing countries.
And not just the Asian Development Bank, many other lenders are also considering giving their helps. For example, the Asian Infrastructure Investment Bank, initiated by China, is also planning to provide aid to infrastructure building, capacity building in those weak areas in terms of public facilities. But you are more experienced than many other banks in the world. What is the best way to address those issues when we are over with the epidemic?
Yes, I have a lot of friends in AIIB in Beijing. Right now, I know most of my friends and colleagues in AIIB now, they are working from home. We are very much encouraged that to seeing, even under this situation, AIIB has been able to provide also very quick response to the outbreak of the virus, and we are very encouraged that AIIB, ADB, and other financial institutions are working together. We used to co-finance infrastructure projects like energy project in Bangladesh and some other countries with AIIB. Now I'm seeing a new area that we should work together is the health system, health infrastructure in developing countries, and also the long-term development of the rural areas, like I just mentioned, clean heating, clean energy for cooking. And this is an area, AIB and ADB and others, we should work together and to improve the health infrastructure, not just to cope with this virus, but also for long-term sustainable development.
As you said, the outbreak of this coronavirus has a lot to do with the weak facilities in many underdeveloped areas. For example, in Hubei, in the provincial cities, some of them are not capable enough to deal with a sudden surge of demand from patients. So for Asian Development Bank and other banks, what is the effective way to buff up the capabilities of those areas in terms of health care and medical supply?
I want to be a little bit modest that ADB, we're providing some funding. Our colleagues in AIB and other development banks are also supporting. But the strength, the effort being undertaken by China itself is tremendous. It's actually what we do is a bit of contribution to this process. Most important is to build the confidence that, and also to learn from this process. We are learning this. There are a lot of uncertainties as things develop, and today we know much more about this virus. than 1 month ago. I am sure moving forward we'll learn even more that China's experience, not only in medical supplies that I'm sure China is able to cope with also with the help of others, including ourselves. But the way of managing a crisis, and this is the biggest lesson, and that the whole world can learn from China, can share this knowledge. ADB can also support our member countries in developing countries with weaker system, healthcare system to cope with the virus. I think that's more important than just technology, than just supplies.
And now we're still in the thick of it. The medical staff and the government officials are busy coping with the healthcare crisis. But there is a bigger crisis probably waiting there. That is the economic ramifications. The global value chain has been affected. A lot of other economies and countries have suffered because of the slowdown of demands from China and the snapping of value chain supplies. What do you think of the extent of the damage?
I see your question, understand your question, and I share the concerns. And as I'm an energy economist, I would like to answer the question perhaps from energy consumption, energy supply point of view. For me, level of energy consumption is kind of a temperature of the economy we can measure. And right now, the temperature is not right. The energy consumption for the last 2 weeks, I've been monitoring the process. It's about 20 to 25% lower than the normal. But that's about these 2 weeks situation. I just mentioned that we had a large energy conference last week. We have energy professionals, when we debate and discuss this economic impact of this virus, we believe that this is a short-term situation. In the longer term, over the year, the impact is not 20%, it's going to be about 1% or less, or about 1% impact on the energy consumption. As I mentioned, that energy consumption is a measurement of economy.
Okay.
I think economy impact will be also around that range. But for us, most important thing I would like to say is that we need to have confidence, confidence, and confidence. Because this is important that we say 3 times. Confidence will help the economy recovery, very important for the world. We have the confidence actually in China, as I mentioned, that China will overcome this virus and other countries will learn from this experience. We are quite optimistic that we'll be able to overcome the spread of this virus in terms of health system, but also on the economic recovery. People are also very confident that this virus situation is a short term, and the longer term impact on the economy would be limited. The interruptions in value chain, production chain will be affected during this period, but over long term we have to be more concerned with the process of globalization and the trade balances. All these other issues will remain relevant. We should not lose our sight in just a short-term problem.
Hopefully, with the confidence and resilience, we can weather the storm this time. Thank you very much, Mr. Zhai. And you've been watching Dialogue here on CGTN. I'm Zhou in Beijing. Thanks so much for watching. Goodbye.